I guess the issue is that there's already a lot of isolation. There's a huge amount of pressure in Japanese society. I think the burden of humiliation sometimes probably rings louder for people here than it might in Australia, for example. That sense of shame. Even one of the cases, and many cases, in fact, of the suicide have been where people have contracted COVID and are so embarrassed or so, I guess, humiliated. They're not able to talk to anybody about it, and then that just builds to be too big for them, and they've committed suicide, which is in itself such a tragic circumstance. But I guess it says a lot about the pressure that a lot of people feel, and that's particularly been, as you've said, felt by women.
What is it particularly, why is the issue so compounded for women?
Well, obviously it's a number of different issues. It's economic, in terms of a lot of Japanese women are working in irregular roles, I guess, whereby they're the first to have been, moved on. Restaurants, bars that have had to close, or their hours are restricted at the moment. So they're the first sort of, to be struck off the old sort of job list. So there's an economic issue that I think is very strong. There's the burden of childcare, of having to carry all of the COVID prevention sort of risks and management of all of that if they've got a family. I think for some women and men too, it's this sense that they're isolated, aren't able to go to work. That's not something that only Japanese are feeling, of course, but it's this humiliation or the shame that sometimes can prevail, meaning that it's tougher for people to sort of get over that. Mental health isn't talked about a lot. It's talked a lot more now than it was when I first came to Japan many years ago. But I think where you have a culture that allows for people to talk more about their issues, and in fact there are counsellors to see, that allows for people to sort of express themselves, and that doesn't happen as much as it might do in Australia, that's for sure.
So you're talking about the taboo of mental health more broadly sort of breaking down a little, but are there facilities, are there places where people can go to get support, even if it is privately?
I think there's much more, your friends might say now, why don't you go and get a counsellor? Whereas, years ago, that was taboo in itself. I was having dinner with a friend on Monday, and he is an employer, and he mentioned that 2 of his staff he had on suicide watch during this coronavirus. One was very, very against the idea of going to see a counsellor, but a younger worker said that they would. So I think it's showing that some of that stigma attached to sort of seeking help is breaking down, but it's still very, very sort of deep, and that makes it much harder. I think also this Japanese society means that sometimes it's difficult to tell people outside of your circle what you might actually be going through, and that's a giant generalisation, and I'm not Japanese, so I don't profess to obviously know that to the extent that Japanese might, but I think that puts a lot of pressure on people to be perfect and to do things the right way, and to be seen to be doing the right way. And that sense of compliance creates that humiliation if things don't go well.
And again, that seems to be, I don't want to keep coming back to women only, but the statistics were really disproportionate for women. There was a 15% increase in suicide. Now, is it partly because the stereotypes of what women should be in Japanese culture don't seem to progress and change much?
I don't know if it's the stereotypes or if it's just the sheer pressure of COVID, economic circumstances that mean that people don't have work, they can't pay their rent, they're too embarrassed perhaps to ask family for more support. We haven't had JobKeeper like Australia has, and I think that there's been a great deal of pressure on families to support people. So more than stereotypes, I think it might be economic, but also this incredible just that pressure that and the chance not to be able to speak to your friends or to go to work and sort of just talk things through, even over a drink, for example, that's all just been taken away from people, and I think that isolation has really built.
So how do you think this minister of loneliness is actually going to work? Will it have any real impact?
Well, I mean, I know that the story has been picked up by the foreign press potentially more than it has by Japanese. The Japanese title, or rather the portfolio that this minister will take, is really attached to regional revitalisation, and that's a great need in Japan to get the regional areas of Japan moving along and bring about that sort of, just giving people more opportunity through jobs and schooling, etc. But he's also going to be responsible for trying to keep the birth rate from delving into sort of really difficult area. Japan's population is expected to plummet. So that minister has that responsibility. And so I think when the government saw these figures, and I don't know if you've seen in Australia at least, but there was a record high number of of minors suicide in the last year. And that, I think, prompted the government to give consideration to looking at how that minister might handle this issue of social isolation. Now, look, it's very easy to say, what can they do? But if empathy is part of that, I think we should all have a minister of social isolation and a minister for loneliness, because having just seen what's going on in Australia, I'm quite disturbed that we don't have enough empathy in terms of our own delivery. So we might not be able to stand on a soapbox and talk about what other countries should do. But for the fact that this ministry or this portfolio will probably have budget attached to it. And so let's hope that they are willing to discuss with people who are working in the field of suicide prevention and mental health, and that people together can work out what programs might support women, children and families in general.
Yeah, I think you're so right, and empathy is something that is in short supply in many parts of the world. Melanie, really lovely to talk. Thanks so much.
Thanks for having me.